Folic acid deficiency, often together with a lack of vitamin B12, can cause megaloblastic pernicious anemia. Only a small amount of folic acid, in micrograms, around 400 to 800 micrograms per day, is needed to overcome this anemia. For decades, the use of folic acid has been limited to this medical deficiency. The same can be said of vitamin C, where 60 milligrams a day has been shown to avoid scurvy, and is used for that purpose only, as an acceptable standard medical practice. Anything more is considered unwarranted. Over the past 4 decades, numerous studies have shown a high incidence of folate or folic acid deficiency correlated with a wide variety of illnesses, especially mental health symptoms. These include depression and cognitive decline in epileptic, neurological, psychiatric, geriatric, and psychogeriatric populations. Furthermore, recent studies in elderly people suggest a link between folic acid, homocysteine, aging, depression, and dementia, including Alzheimer's disease and vascular disease. Science now tells us much more about the need for folic acid than what we previously knew. In short, the folic acid is a critical nutrient and it reduces heart attack death. It maintains mental well-being and prevents crippling birth defects. In fact, folic acid supplementation can prevent the majority of neural tube defects in newborn babies, and all pregnant women are encouraged to take prenatal vitamins and adequate folic acid for this purpose. Sad to say, but only 11% of all Americans get enough folic acid from their main source: liver, kidney, broccoli, beef, kale, turnip greens, and beet. Cooking destroys as much as 90% of a food's folic acid content. The average American over 50 years only takes around 130 micrograms of the folic acid per day, when the recommended daily allowance is at least 400. This means the average American has a folic acid deficiency. Its level is also depleted by chronic alcohol consumption and by medications like anticonvulsants. In fact, studies have shown eating 400 micrograms of folic acid from food alone doesn't raise the serum folic acid concentration anywhere close to that's obtained by simple folic acid supplementation. You need more than what the food can provide. Folic acid is easily depleted by drugs. The non-steroidal anti-inflammatory drugs, including aspirin and ibuprofen, deplete the folic acid, and these can potentially lead to a folic acid deficiency. The popular class of anti-ulcer drugs, known as the H2 receptor antagonists, like Zantac and Pepcid, also deplete folic acid. Instead of encouraging simple folic acid supplementation, the US FDA implemented a policy of mandating certain foods be enriched with folic acid in 1998. Since that time, folic acid was added to certain grain products, including cereal, bread, pasta, and flour. This has resulted in higher folate levels in adult Americans. Unfortunately, the amount of enrichment, while enough to protect the pregnant women and the fetus from neural tube defects, is hardly enough for optimal health. Only 636 micrograms is present per pound of such enriched foods. While some of these foods are good, the majority fall into the category of junk food because they're high grain and refined sugar content. Obviously, eating junk food as a method to supplement with folic acid is not the best way to optimize your health. Folic acid is important for the functioning of the nervous system in everyone. There's no exception. A folic acid deficiency has serious implications to health. Without the adequate folic acid, the normal development process becomes dysfunctional. Symptoms associated with errors of the folic acid transport and metabolism include developmental delay, cognitive impairment, movement abnormalities, depression, seizures, vascular changes, and peripheral neuropathy. In the fetus, the relation between the maternal folate status and the risk of neural tube defects is well documented. A folic acid deficiency at the time of conception is known to increase the risk of birth defects like spina bifida. Clinical trials have shown preventative treatment prior to conception with 400 micrograms or higher of folic acid significantly reduces the risk of such birth defects. The RDA is therefore set at this level. In adult patients presenting with anemia due to folate deficiency, approximately 2/3 have neuropsychiatric disorders. If untreated, nearly all patients would eventually develop severe neuropsychiatric complications. While the exact mechanism of folic acid's association to neuropsychiatric symptoms is still not fully understood, mood and subcognitive functions might be related to the methylation process within the brain. With respect to depression, this hypothesis is supported by the similar effect of S-adenosylmethionine to that of folic acid on the mood, and by the influence of folic acid and S-adenosylmethionine on monoamine metabolism. This is associated with depression. In fact, it's known that the lowest concentration of folic acid and S-adenosylmethionine in cerebrospinal fluid is found in dementia, including in Alzheimer's disease. Folic acid deficiency is a completely preventable condition, yet it exists worldwide. The highest incidence of folic acid deficiency, as measured by serum and red cell folic acid concentration, is in the elderly populations, especially those with psychogeriatric background like depression. It's interesting to note that folic acid concentrations in serum and cerebrospinal fluid and plasma homocysteine rise with age, as the natural aging process. It's been shown in a prospective community-based study on 370 healthy elderly Swedish subjects that a folate or vitamin B12 deficiency doubled the risk of subsequently developing Alzheimer's disease. This was again confirmed with a much larger and longer Framingham community-based study, where a raised plasma homocysteine concentration doubled the risk of developing Alzheimer's and non-Alzheimer's dementia. Folic acid is now recognised as an important factor in the prevention of heart disease. Studies have shown people who suffer from heart attacks have lower amounts of both dietary and plasma folic acid. Carotid artery stenosis, leading to strokes, and peripheral vascular disease also appear in a high frequency of those with low folic acid levels, or folic acid deficiency. The folic acid may lower the risk of heart disease by preventing damage to the inner lining of the arteries. It's been known for around 20 years that a high blood level of homocysteine is a potent and important risk factor for heart disease. After decades of research, it's now accepted that a high homocysteine level is a risk factor for premature death, whether it be from heart disease, stroke, cancer, or lung disease. A high homocysteine level is also associated with Alzheimer's disease, as well as depression, multiple sclerosis, menopausal symptoms, and rheumatoid arthritis. Too much homocysteine, which is formed naturally when the protein is broken down, can cause oxidative damage to the endothelium. Oxidative damage is caused by free radicals, byproducts of the body's normal processes that can damage the body tissues. In fact, the risk of heart disease triples when the substance's blood levels exceeds 15.8 micromoles per litre, a reading still considered by many to be within the normal range. The optimum target should now be under 8 micromoles per litre. Worse yet, the odds of heart disease are directly proportional to the homocysteine concentration. The higher the homocysteine level, the higher the risk. This direct correlation has been well researched, including in a study conducted by the University of Bergen on 2,127 men and 2,639 women aged between 65 and 67 years, between the years 1992 and 1993. By February 1997, 162 men and 97 women had died. 121 from cardiovascular causes, including stroke, 103 from cancer, and 33 from other causes. Using a baseline homocysteine level of 9 micromoles per litre, the researchers found for every 5 micromole per litre increase in the homocysteine level, the all-cause mortality increased by 49%. Cardiovascular mortality increased by 50%, and cancer mortality by 26%, and deaths from other causes like respiratory, gastrointestinal, and central nervous system diseases by 104%. Looking at it another way, dropping the homocysteine level by 5 points can reduce the heart disease risk by 50%. These percentages refer to the values obtained after adjusting for a variety of lifestyle factors, including cholesterol level, blood pressure, smoking, body mass index, physical activity, age, sex, and baseline cardiovascular disease risk. About 78% of this study group had homocysteine levels at or above 9 micromoles per litre, and 12% had levels exceeding 15 micromoles per litre. It's interesting to note that smoking and drinking coffee were associated with higher homocysteine levels, while taking vitamins and exercising was associated with lower levels. The result is clear: lower your homocysteine level if you wish to live longer. In another study published in the Journal of the American College of Cardiology, researchers found that heart disease patients who took 5 milligrams of folic acid per day, not micrograms, for 12 weeks had slightly better functioning of their arterial inner lining or their endothelium than those who took an inactive placebo, and a greater ability of their arteries to widen appropriately. The good news is supplementation of folic acid is necessary to maintain healthy levels of homocysteine. Scottish researchers in a study have concluded a total intake of 926 micrograms per day is needed in 95% of the general population between the ages of 65 to 75 years for the prevention of high homocysteine levels. Those who already have high homocysteine levels will require more. Therapeutic doses to lower the homocysteine level of folic acid are 3 to 20 milligrams, vitamin B6 50 to 100 milligrams per day, and B12 100 to 5,000 micrograms per day, in addition to a foundational base of optimal multivitamins, minerals and enzyme fortification. Folic acid is also used for cancer prevention and reversal. A Harvard study of 16,000 women and 9,500 men showed those who ate 700 micrograms of folic acid per day had 1/3 less risk of getting precancerous polyps in the colon compared to those only taking 166 micrograms per day. The smokers need 3 times more folic acid to have the same effect as a non-smoker. In another study conducted in China, researchers found animals who were given a known carcinogen had a 62% less chance of developing stomach cancer if 20 milligrams of folic acid was taken a day. A folic acid deficiency has also been associated with cancer of the throat and colorectal cancer. According to Dr. Atkins, he typically prescribes 30 to 60 milligrams a day, together with vitamin C, B12 and vitamin A, to reverse cervical dysplasia, an abnormal cellular change that's precancerous. In another study, cellular dysplasia in a smoker's lung has been reversed by taking 10 to 20 milligrams of folic acid, together with 750 micrograms of B12 over a year of treatment. Folic acid also acts as a painkiller in high doses. At 6.4 milligrams per day, with little B12, it's been shown to match the pain relief property of non-steroidal anti-inflammatory drugs. The use of folic acid in megadoses over 1 milligrams per day is practiced by a number of nutritionally oriented physicians for the treatment of a wide variety of health problems. Dr. Carlton Fredericks believes folic acid has estrogen-like effect and can help with menopausal symptoms at doses of 40 to 60 milligrams a day when taken together with boron. Dr. Robert Atkins reported using this dose together with pantotene, essential fatty acids, and a sugar restriction diet for colitis, Crohn's disease, and other painful inflammatory bowel disorders. He reported an 85% success rate. A 50 milligram daily dose in the form of methyl folic acid can treat depression as effectively as the drug amitriptyline, according to one study. Some doctors have used folic acid successfully in doses of 20 milligrams or more without side effects for the treatment of postpartum depression. Some 50 years ago, the FDA set a limit of 800 micrograms as the amount that can go into folic acid supplements, thinking that more folic acid may mask a deficiency of B12 and result in people developing pernicious anemia and not knowing it. Contrary to the FDA's dosage limit, folic acid has been shown in numerous studies to be one of the safest supplements to be taken in large amounts. The theoretical possibility for masking a B12 deficiency can be avoided by also taking a B12 supplement. Folic acid is safe to take in large quantities to prevent a folic acid deficiency, assuming you're not B12 deficient also. The recommended daily allowance here is 400 micrograms per day. For general health, it's 400 to 800 micrograms per day. For optimal health, 2 to 6 milligrams per day. To lower the serum homocysteine levels, 3 to 20 milligrams per day. For cancer reversal, peripheral neuropathy, psoriasis, menopausal symptoms, postpartum depression, and colitis, it can be 10 to 50 milligrams per day. Folic acid supplements should also be taken in conjunction with B12, and preferably vitamin B6 also. In certain cases, intramuscular injections might be the most beneficial, such as that that's used for the treatment of peripheral neuropathy. Taking folic acid together with probiotics and digestive enzyme supplements to increase the absorption is also recommended. To learn more about homocysteine and methylation, or to book a consultation, learn about herbs, supplements and natural treatments, check out my website.